My name is Roland Darey. I'm an emergency physician at Newman Regional Health. What appealed to me about Newman was that it was an independent hospital and that it was still run by a local person who lived in town, and so that if I had some issues, I knew that I could go to the top of the leadership structure and the person would be in the same building that I was in and not in a different state. The emergency room here is a great emergency room. The rooms are all big and there's plenty of room to do what needs to be done. Multiple people can come into the room, and so I think the patients are better served because there's plenty of access for everybody that needs to get into the room, whether it be x-ray, lab, nursing. Everybody can get into the room and patients can get what they need much quicker and much more efficiently. At each patient encounter, I really try to say to myself, if this were my brother, if this were my dad, if this were my son, and they were at a different hospital, what would I want them to do? And that's what I try to do. And when it comes to how you want to treat people, I try to also keep in mind that I want to treat the patients that come to Newman the same way that I would want my dad, my brother, my friend treated if they were at an emergency room with the same problem. I have worked in different emergency rooms, and one of the things that I think is one of the strengths of this emergency room is that the nursing staff is top to bottom provides some of the best nursing care I've ever seen. They're smart, they're compassionate, they're very technically competent, they work well as a team. If I were needing emergency room care, I would want to come to a place like Newman.